Hello, everyone. Yes, it's Joan Kaler, and welcome to my podcast. It's been a while. You all know how I like to operate quality, not quantity. I have a wonderful guest today, and I'm going to about, read to you her bio so you can get a general idea. This is really, really cool, everybody. You are going to love this. So hold that thought, and I'll bring it up. Rosanna, and I hope I pronounce this
Mhm.
G. Rosanna,
Giuliani.
I'm sorry.
Giuliani.
Giuliani, there it is. She is a licensed acupuncturist, state licensed in Pennsylvania, board certified acupuncturist with nearly 2 decades of experience and extensive postgraduate specialization, with a special focus on treating chronic pain, joint and spinal issues, migraines, and a wide range of neurological and other health conditions. Rosanna's approach blends the precision of Western acupuncture techniques with the depth of traditional acupuncture styles. With her extensive background in anatomy and functional movement, she works comfortably with people of all ages and backgrounds and activity levels, from those managing chronic and degenerative health conditions to sports enthusiasts and athletes. Her background includes rare and sought-after certifications in multiple systems of neurological acupuncture, including neuroacupuncture, neuromeridian integrative acupuncture, and French medical, Roseanne, help me with this, Rosanna, acuculotherapy.
Auricular therapy.
Thank you.
The French say it.
Okay, this gives Rosanna unique expertise to help neurological conditions such as stroke recovery, Parkinson's disease, multiple sclerosis, traumatic brain injury, and post-concussive syndrome and cerebral palsy, among others. So I'll give you her contact information later in the podcast. If you're in Pennsylvania and you struggle with any of these challenges, you need to call Rosanna and go see her. I'm not just playing here because we are so lucky in Pennsylvania to have her. I wish she was at the other end of the state because I'm in Pittsburgh and she's near Philadelphia, Lancaster. So, everybody that's listening around the world and in the US, thank you for listening to this. She is going to demystify acupuncture. It's not weird. There is science behind it. Okay, I'm going to keep quiet right now and welcome in Rosanna. Hi, Rosanna. Thank you so much for
Oh, hi,
joining us.
everyone. Thank you for having me.
Oh, this is such a joy.
Well, I hope to not disappoint. It's exciting for me to kind of give another layer of acupuncture, what it is, hopefully answer questions that people have, whether they're curious about it, whether they know about it. I feel like
Mhm.
there's always something new learned. So I'm
Well, let's
excited.
start out with the basics. What is acupuncture?
So acupuncture has been around for over 5,000 years. Eastern, they call it, it's now been labeled not Chinese medicine. They like to say no more Eastern medicine because there is the Chinese style, there's Korean style acupuncture. So there's actually a lot of different styles of acupuncture.
Oh,
But the beauty of it is, when we go through school as far as acupuncture, which is about 3 to 5 years, full time masters, it's a lot. It's a lot to take in. You think you know stuff, and you're like, oh no, I don't. And there's oftentimes a lot of physiology and anatomy associated with that. However, some of us think it exists. Some people are kind of like, oh, I'm good with understanding the stomach meridian and the chi and the energy, which makes sense in a lot of levels. But also, it's kind of like, well, what do these points actually attribute to? What do these points do? If there are 3 points that are on the wrist so close to each other, why are there 3 points on the wrist so close to each other? So a lot of times people, especially over the years, Western medicine and such like that, they oftentimes will say, "Oh, it's placebo effect." They don't really know how it works. They say maybe it works. They don't know how it works. Um, and I've been fortunate enough to have teachers that are geeky enough to go through the translation of old Chinese text, because I can't read Chinese as much as I'd love to. It's not my forte. But I've had fortunate enough to have teachers such as Dr. Pony Cheng and other teachers who have gone through the historical past of acupuncture and why the points exist. So what we're finding is that every single acupuncture point on the body innervates either a motor nerve, a sensory nerve, both, where a nerve starts, where a nerve ends, and then maybe where a nerve can either bifurcate, meaning splitting into two, or where it trifurcates, splitting into three. So as I tell a lot of my patients, I like to say the brain and the spinal cord is like Grand Central Station. Think of it as a subway station. Everything from the brain and the spinal cord that branches out. So let's keep it meridians. We look at the stomach meridian, we look at the small intestine, we look at the heart, we look at the pericardium. Layer that with blood vessels, layer that with lymphatic tissue, layer that with fascia, muscles, right? It all coincides. And it's all these acupuncture points are like subway stations. And the routes to these subway stations are our neurological system, our lymphatic system, our blood, our vascular system. So everything kind of follows in line with each other. And what we believe is that in the day, with Eastern practitioners, they spoke their language. Well, their language wasn't, X, Y. It wasn't, the sphenoid nerve that goes to the brachial plexus that goes to this. It was, we go by, is it early fall? We're into the harvest season. So we're earth points. We're talking spleen and stomach. We found they were fabulous anatomists. Somehow they were able to associate, if you press here, you can actually sense or feel that nerve. I don't know whether or not they did cadavers in the day, or dissection, but I have to think that maybe they did, because some things are very superficial, but some things you really have to, if you do a cadaver, if you look at dissections, you actually see the nerves running up and how they affect, how they connect. And it's really cool. It's really amazing. And then everything associates. So oftentimes when we put needles in a person, they're like, well, how does it affect me? Generally speaking, when we put needles in a person into an acupuncture point, you can do pressure points such as the EFT with the tapping, things in that sorts. It basically is a signal that's sent up to the brain. So an afferent signal sent up to the brain, turns the brain on. The brain then sends a signal. Now, it's up to us on what the signal is, but oftentimes it's going to it can release some dopamines, it can release some serotonin, it can release some cytokines. So it releases all of these chemicals down to react in response to the area that's being stimulated. So that can bring fresh blood and oxygen to an area. Whether it's distal or then, and it impacts the entire central nervous system, right? It's all associated. We can get into a little bit of the brain gut axis and some of the new stuff we're finding out even more so through the nasal palate and the stomach, and why we're seeing a lot of more neurodegenerative stuff going on. And it's, we're finding these evidential things, even from, what we're seeing on the scalp of people, what we're seeing on things in that sorts. But it's really fascinating, because in my mind, I always tell people the body is an amazing thing. It knows in some way, shape, or form how to correct an imbalance. However, sometimes imbalance isn't always the most efficient, right? It might be for the body at that point in time. And by that, I mean, the brain registers it. Okay, well, I see this, so I'm going to do this. And this is the new form way now. But it might not be the most effective form. So another way I describe it to people is oftentimes we get sick. We have a little pebble left behind. We have a surgery. We heal. We recover. Another little pebble's left behind. We have kids. There might be some trauma, things in that sorts that take place. And there's these pebbles that are consistently left behind. And what I call it is, it's at some point they'll start to build, right? And they create a dam in the systems. And when there's a dam that takes place in the system, right, the river can't flow through straight as it normally would. It's now having to traverse right, traverse left. And it's great because it's still maybe, hopefully, getting to where it needs to be, but it's all these side courses. And so certain things might start to misfire. Other systems aren't getting you can call it energetics, because it
Right.
really is. If a
So,
certain area of the body is not getting blood, it's not working.
quick
Yep.
question here that I wanted to ask. When you talk about the flow of the river, you're referring to the qi or the chi that the Chinese talk about?
Mhm.
Okay.
Yeah, yeah. And you can represent flow. I mean, in truth, everything has energy, right? So you can talk about having energy. If we don't have enough blood in our, there's not enough blood in the vessel, we're going to start to have some heart issues or maybe some anxieties coming up.
Mm-hmm.
If things are too much up here and not enough at the lower half of us, because our culture, we're so go all the time and we fatigue ourselves. If the lower half, such as the kidneys, right, grounding, or if you relate more to the chakras, right, if your root is not there, can't literally send energy up to grab the lung, to grab the breath, take in, it can't come up and grab it. And this aspect is, if there's a block in the middle section, if there's a block on the upper section, these areas that you breathe in the air from there, the lung meridian is what we're talking about. You breathe in the air, the lungs take the air, send it down to the lungs, and you have fluid, right? So
Mm,
if there's not enough fluids, what happens? Dry skin, we can't breathe. There might be some restriction as far as vasculature, both blood and literally fluids in the lungs aren't producing the way they need to, or things can get stuck
right.
and congeal if there's heat in the system or something. Or same idea, if it's just able to move down, there's stuff that gets stuck. When we get stuck, that's when we
Yep,
start
yep.
to have some of these medical or that feeling of chest pain or inability to. And so we need that connection from upper to lower. And so that's what I mean by these rivers or chi or energy. If certain things aren't functioning in the direction that they do, the body will be a little bit smart on how to offset that, but it's not always the best offset.
Mm-hmm.
Where some of the health problems that come into place, especially folks, like when we deal with a lot of emotional sets, right? We have you have some of your real clinical ones like bipolar, manic depression, things in that sorts, but there's so much anxiety that we have. And as well as maybe, when people have anxiety, it represents very for each person. Some people, the anxiety, it represents digestive issues. Some people, the anxiety presents as vivid dreams, like just more like chaos going on. They can't get out of their head. They're
Yes, yes.
ruminating. And these are things patients come in. I always say sometimes as acupuncturists, we're having to be a little bit of psychotherapist too, because we have to understand the type of person and how their stress, anxiety, or certain things is representing in their body, and what might be that disconnect.
Mhm.
Is there just too much up here? Is there a block up here? Is there a block in the
Mhm.
stomach?
Mhm.
Block where things just aren't moving correctly. So if we can send a signal via certain points of the acupuncture on the body
Mhm.
to connect to the
Yes.
brain, we now can send that. It can be energetic, it can be nerve related, it can be blood flow related, it can be lymphatic related. It's all kind of in that same context. We're sending a message up to the brain, letting the brain say, wait a minute, I've got a little ding 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 over to this part of the body. I should send some down there, some juju, send some energy, send something down there so that it. Um,
So then
we
the one question that I have too, and let's address this for everybody out there, because I always get this question.
yeah.
Needles, doesn't that hurt? And I go, no, because they're not Western needles and they're disposable. She's not going to try and um, sanitize them and use them over again. And
Mm-hmm.
there are different sizes of needles. So no, they
Yeah.
don't. So address that. When one of
So
your patients said, "Oh, isn't this going to hurt?" And then the
uh,
electrodes that sometimes some people use, and even cupping.
yeah,
I had that done once.
there's there's so many things I could say, but it's great. And then in hands, it's like, oh goodness gracious. But the beauty of, so the needles themselves about the size of human hairs.
Yeah.
So I think I read an article quite some time ago that said it takes about 30 acupuncture needle to fill a hypodermic needle. And the hypodermic needles are the needles that we get our shots with,
Mhm.
like if we get a pain or they do any kind of cortisone shot, things in that sort.
Mhm.
And some of them are a little bit thicker. You have to go into deeper tissue,
Okay.
right? We don't want too thin of a needle because, believe it or not, it actually can be sensitive. And then, but if I'm doing something on the face, I'm going to use a light needle because there's things more superficial than we might think there to be. Here's another perspective. I asking patients this. I'm like, have you ever popped a blister? Some are like, no, never. Some are like, oh yeah, and usually you take a safety pin. I probably shouldn't. You pop a blister, you take a safety pin. Hopefully you're sterile in some way, shape, or form, and you pop it, right? And you used to come out. Everybody's got their own technique. I like to play. What do? I took an acupuncture needle, put the blister, took it out, was so satisfied, like just not satisfying at all. I get a little of blister fluid, and the blister still exists. So that's small when we think about it. Some
Okay.
people are like, well, what about the vasculature and things in the arteries and stuff take a deeper set inside. So it's just, yeah, sometimes when people get a little freaked out with that, like you get blood, you actually have much thicker needles to a blood vessel and take blood out of the vessel, and then you just put pressure on it. Sometimes even just a small vasculature, sometimes it happens. You're never going to bleed out. There's a great SNL skit. I didn't tell you this, but there's a great SNL skit that has a patient. You can see they have something on the back or something, and they're sticking needles, and he's just gushing blood all over the place.
Oh,
But you have to have a good sense of humor about that. Nothing like that happens
no.
unless you're for that technique. There is in Eastern culture, there are some called bleeding techniques. So that is more like a medic lancet that they use, and they'll bleed a certain area to reduce heat in somebody. I personally am not a fan of it. Just
Well,
my
I've
forte.
had
Other
acupuncture
people,
myself for lower back problems
yeah,
and my knee, and I enjoy it because I understand it. And then my
super relaxing.
acupuncturist, she's from Beijing, and she
Nice.
said she came over here. She got trained both in Western medicine and Eastern medicine. She goes, "Oh, too many hoops to jump through to be a doctor over here. I'm just going to be an acupuncturist." But she is so amazing how she died. And I said, she diagnoses with the tongue and
Yeah.
taking the pulse like a
Hmm.
real Chinese doctor. She goes, "Your liver is on fire. We have to calm your liver." I go, "Okay, do your thing." But it was amazing. And now my boyfriend gets acupuncture.
Yeah. Yeah.
So, yeah.
Usually folks who are a little bit hesitant about the first. So this is the cool thing too is, and sometimes I have little kids. Like I had two this week, including a baby, and we don't do needles on babies, So we have a technique called shonishin, which is kind of
Mm,
like a tapping on it because they are so small that their stimulation is it doesn't take much.
mhm.
But that's why we use tacks. I call them tacks. They literally look like a tack. They're like a Band-Aid with a silky
Yes, yes,
tiny
yes. I've used
bead.
those too.
You can,
Yes.
yeah, yeah, you can use those. But oftentimes when people have their first or second initial acupuncture, they realize like, okay, once it's in, it might feel a little pinch here and there, but generally speaking, once and you're just like in la la land. Speak
Really,
people
real,
are high
it's
strung.
so relaxing. I mean, needles when you get a blood draw is more of a pinch than an
It's a pinch.
acupuncture needle.
Yeah, yeah. For sure. And then the electrostim, so some patients do well with that, some patients don't. So it's as folks, even when I'm doing acupuncture, like I have to write recipe for you. Meaning that what for one is not going to be the exact recipe for you.
Mhm.
So by that, but the electrodes are really interesting because you have like 2 hertz and 4 hertz, which end up being GABA rhythms to the brain. So it's a nice
Nice.
rhythmic signal to the brain. A lot of patients will fall asleep.
Hmm.
The only time higher hertz is if we're looking at the head. We
Hmm.
need to have a higher stimulation, more sensory nerves are sensory based. We want a higher stimulation so
Hmm.
that the signals kind of attribute. That's with people who might have some numbness, neuropathy in the hands or the feet because they can't feel as much ice. So we want to get them feeling, which means we amp it up a little bit, but it's actually a nice current base for each patient, depending on what you're working with. Does
That,
that answer your question?
yes, beautifully. Oh my gosh. So it's the biggest question I try and explain is now everybody asks me this all the time. I want to use my insurance. So do you give super bills? Do you take
Yeah.
insurance
So
and give super bills?
In our practice, we take superbills. There are some practices that will take Medicare, Medicaid, some practices that will take insurance.
Hmm.
You're going to find it's a little mixed bag, the practitioner. And truth be told, I have tried in the past to do insurance, and it's extremely difficult. We're not seen in the same context as an MD or a doctor office.
I get
So
it.
to get
Mhm.
reimbursed or paid is a challenge. However, we're spending a lot more time, in my opinion, with patients
Right.
and looking at the whole systematic approach. I mean, there's been times I had a patient that was coming to me for uh, some tremor things, and I put him neurological test, and he was still seeing a neurologist. So put him through some neurological tests. I'm like, yeah, I don't see a Parkinson beta, but I'm not. I tell him I'm not a doctor. I cannot diagnose that. I'm just telling you from neurological tests what I'm seeing. And he was cute. He's like, you prepped me for the neurologist because he's like he did the same test and the same thing you did. I'm like, well, that's good to know that I'm like at least perceiving correctly. But it's lost my train of thought a little bit, but the ideology, I get talking and I lose my thoughts. Bear with me. It's getting older, maybe.
Believe me, I'm the oldest one in the room, so no worries.
uh, no, um, but the idea is to communicate and talk with patients a little bit to understand um, where they're at, but also kind of perceive where they're coming from too. And you know, sometimes Western medicine is too rushed and they
Yes.
just go by signs and symptoms.
Well,
And when they just go by signs and symptoms, I mean, they're like, oh, well, you have an underlying back issue, so it's coming from your back. Meanwhile, the patient has a big black and behind their knee. It's like, no, there's something going on with the knee.
hmm.
And so oftentimes, and I've had a colleague of mine who's out of Scranton who there was a patient of hers that just had a baby. I think she had a cesarean, and she kept complaining of flank pain, like lower abdominal pain. It was just a lot of discomfort. And she went to the urgent care and OR time or ER, excuse me, a few times, and they're like, "Oh, well, you just cesarean. It's normal to feel that discomfort and pain."
Oh,
She came in and she's like, "Can I palpate your stomach?" She's like, "Yeah," and she did, and it's like hard, 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 hard. She's like, have any of the doctors like, please tell me they've palpated your tummy? And she's like, no. So out of all these visits that she had, no one had taken the time to just palpate her stomach. She did get a CAT scan, and my colleague, my friend, had said to her, "I think you might have a hernia, and that could be very well causing your pain." So yes, you had a cesarean. Do think that you have a hernia, which is part of that discomfort you're having. And the CT scan came back a few days later, and she's like, "That's what I got," and it was a hernia. And it's
oh,
unfortunate. So in some beautiful aspect, as acupuncturists, we do get the opportunity to be more hands-on with patients
yes.
and get a full picture. A lot of times with the intakes that I'm with patients, I'll ask them, like I have an interesting patient now. She's such a doll. But I had asked her, "Have you had any traumas in your past life?" She suffers from a lot of vivid dreams, and has done many things. And I'm like, "Have you had traumas in your life?" And she's like, "Well, she started with a couple, and then as we progressed, she was telling me some other things that she remembered now that occurred. And it's funny, it's really fascinating how certain things still come up. And we're finding even trigger based on certain acupuncture points that will trigger some memory that she may have had even as a kid. And this is fascinating. I don't know if you've heard of Gay Hendricks conscious living.
I've
Um,
heard of it.
He's been around. It's been out forever, but it was an epiphany to me as far as how the tissue, like their body remembers things even when we're in fetus, right?
Yes. Yes.
And if it's kind of a theory, if you're brought to this world unwanted, you'll generally tend to have personality traits or characteristics or habits to want to be accepted, to want to be wanted, without knowing all of that behind there. So it's really fascinating. Just to even see how certain points will bring up memories for her, which
Absolutely. And
is
I'm
neat.
a student. I love generational trauma. You don't necessarily have to have the trauma in your current life. You could have inherited the generational trauma.
Yeah, yeah. And
Yeah.
you see a lot of that.
Tissues hold it all. And then whether it's acupuncture, and I've been trained that the chakras, which are the major energy centers of the body, and the biofield or the aura around us, holds
Mhm.
every memory, every experience,
Mhm.
every trauma, so that I work to help my clients release those memories, those traumas in their energy system, in the biofield, because in my course, it's called the fourth wave of healing. It's not always in the meridian system.
Mhm.
It might be in the chakras, it might be in the biofield, but they're all interconnected one way or the other. So I'll go into meditation to figure out which system is the best for this person and their situation. It's just amazing to me. So for instance, Rosanna, if somebody has anxiety, what point, where would you put the needles? I mean,
Mm.
you obviously have to have an intake and a diagnosis and all that stuff. But
Yeah.
I mean, including the stomach meridian, is there any other place under the eye and by the mouth and under the ear?
So
Any other places you
are you
put
looking specifically for the EFT overlap?
it? Yeah.
Is that what you're looking for?
Uh,
I definitely will get into that. But if somebody came with anxiety,
yeah.
my my true ones that I will do, generally speaking, I love the head and the ears because
Ooh, yummy.
it's like turning on the television.
Yes, yes, yes.
So there's 2 points on the head called, it's, foot motor sensory area. It's kind of like really middle of the top of the head, but
Okay.
it covers kind of the frontal cortex and prefrontal cortex a little bit along with motor. So if somebody has back pain, it's a twofer. But where the location of it is actually hits 3 of the 4 ventricles of the brain, vasculaturely wise. So what that means is it will help a lot of the rest and digest symptoms. So it will help sleep cycles. It will help. I've actually had a patient come out of a cyclical like PTSD and
Oh,
always kind of in that cyclical form, starting those points with him, still doing his original therapy, he was able to get out of that cyclical cycle, which he had been in for years. So again,
beautiful.
resetting the brain a little bit to find that new norm. My other favorite is right here. We call it, it's traditional Chinese medicine calls it um, GV23 and 24. It's heart heat,
Okay.
essentially.
Okay.
But this correlates specifically with the front cortex of the brain. This is our limbic system. This is our emotional center. Um,
Beautiful. Yep.
so it's a nice point to kind of do that. So if people who tend towards anxiety or depression, depends. If they're really up here, I kind of do it in a different direction to kind of guide the energy down, in my opinion.
Okay.
Um, Yin Tan is also another one that we do. I know EFT, we do, you guys do a lot of the Taiyang.
Yeah.
Yin Tan, because it kind of it almost replicates where the pineal gland is,
Yes, yes, yes.
the palatine area. So it's kind of like, again, sleep cycles. It's the third eye, right? You look at Eastern Indian cultures and they have dots here as their religious symbols. So
Right.
it's almost like, and it's our third eye, right? Our indigo. It's that centering. Yoga. It's our centering.
Mm-hmm.
It's a beautiful point to like allow a person to just center. And then the ears, love hate. Everyone loves them. Everyone hates them. So the ears, I learned a technique called relaxation triad from my teacher, and Dr. Limi actually, it's kind of brilliant. So he calls it the cosmonaut point, just as it sounds, like kind of floating in space, cosmonaut,
Mm-hmm.
but it actually sits at the L2 spine in the ear. So the L2 is the point of the ganglia for the sympathetic tone in the body.
Mm-hmm.
So it brings things downwards. And then there's the sensory mouth point, which is kind of on the lobe of the ear.
Mm-hmm.
It's considered the midpoint of the brain, but
Okay.
he really has a lot of anxiety, even more so, and needs a bit of a heavier hit. There's the reencephalon, which is a little more specifically for the emotional context. And then corpus callosum, which balances both hemispheres of the brain. It is like, it's basically how it's what's the word I'm looking for? It's basically like a Valium.
Oh, okay.
It really go like a
Rosanna,
Valium for
touch those
people.
points again, please. Instead of a
Yeah.
Valium, try this.
So I always say people don't really recognize the ear as much, and the is basically an upside down fetus.
Oh,
Okay, think of it that way.
okay.
For the ear, much like I believe the EFT points to be, is kind of representing a little bit more the cranial nerves,
Mm-hmm.
which all is the brain, and all the cranial nerves hit the ear at some point or another. Points are, it's kind of like right on the inside. What was the Shen Men? But if you put your finger in your and you find a little divot there at the
Yes.
very top, that's cosmonaut.
Okay.
If you take, even if you just were to rub your lobe of the ear
Ah,
gently,
okay.
you're the mass. Most of us have ear piercing or holes,
Right. Like I do.
but
Okay.
yeah, sensory master is right kind of in there. There's actually a lot of good juicy here, but that's why I say even if you gently just massage, I
Mm-hmm.
find that you'll stimulate just to really kind of keep the body centered. Even just work
Beautiful.
all the good things. The other one is right on the tragus, outside the
Okay.
tragus here. So
Okay.
it's literally right on, it's kind of like so it's not right in the ear. It's like, let me get really close in. It's kind of right
Oh,
here. Oh, you know what?
okay. Uh-huh.
Yes. Let me see if you guys can see it better on this. Maybe you can, maybe not. It's like
We're gonna have to hold a little bit higher.
right
Okay.
here.
Okay.
Yes.
Uh-huh.
Cosmonaut is right here.
Okay.
Sensory master point's kind of the middle of the lobe.
Okay.
And then you're looking at corpus callosum or hemispheres, both ears, right at the outside of the tragus there.
Neat.
My fun little ear charts.
Okay, folks, everybody start massaging your ears.
You can, like, even just kind of massaging, just tell
Yeah.
them this too, like, this is the best thing you can do. Scalp massages, best thing ever. And then same, like, just running along, the tragus,
Mm-hmm. Mm-hmm.
and doing that is like basically every aspect of the vertebrae down the spine.
Oh, that's beautiful.
Cool.
Oh, I wish I lived near closer to you.
We can talk anytime. I'm due for a visit up that way, so we'll have to meet for both visits.
Yummy. Yes. Rosanna, this has been absolutely fabulous. Now, if somebody does live, well, you're licensed, but you don't take insurance, so people come and see you wherever they are. I mean,
Yeah.
you're so close to the Delaware border and the Maryland border. You ever get any patients from down there?
I get people from Jersey.
Okay,
I just had a kid in last week from Williamsport, Pennsylvania.
beautiful.
Yeah, so I get Maryland, not much per se, but the other thing too is there's a couple as far as a network of folks who do the neuro stuff. So if somebody's looking for neuro people, and they live in a certain area, oftentimes know who each other are and can refer if there's somebody a little closer. But I do get some people. New York has a few good professionals up that way too. Refer if they didn't want to come down, but then again, has some people prefer male practitioners over female, vice versa. But yeah, so there's oftentimes Pennsylvania, Philly, east to west, outside Lancaster,
Mhm.
um, north, Jersey. I'm trying to think of our further north, but there's sometimes people will drive a few hours for sure.
It's fantastic. How do people reach you? Do you want to give a
Um,
website, a number, an email? What do
yeah,
you want people to have?
yeah, absolutely. So you can look at the website. It's Inner Wellness Acupuncture. I think it's
Okay, I'm going to say this again. We
yeah.
have to go slower on this.
Yeah.
Inner Wellness Acupuncture, and then is it a dot
So
com
it's
or
Inner Light. So the website, I'll give you the website. It's
oh,
iwacupuncture.com.
okay, hold that thought 1 second here because I just want to bring it up.
Yeah, make sure it is up, please.
Okay. IW, and then what's the rest of
I
it?
hold on. IL as in Larry W.
Okay.
Acupuncture.com.
Acupuncture.com. Hold that thought.
Make sure it's right. Inner Light Wellness.
It says, there you are. Love your life with acupuncture. Okay, I'm coming back here because I want to share this with the
Oh.
world. Okay, here is Rosanna's. Here it is.
Oh,
I
look at you, fancy.
oh, I do this all the time. Oh, what a beautiful, look at this, people. Run, do not walk. Fly, do not drive.
Oh, thank you.
Oh,
All the fun.
beautiful. Look at this, everyone. Specialties include chronic pain, peripheral neuropathy, women's health, autoimmune and neurological conditions. She is so talented, everyone. Honest to
Oh, thank you.
Pete. Oh, we are so lucky. Oh, I've got chills
Oh,
because,
well, I'm excited and honored to be, part of the podcast. So I appreciate the invite.
oh no, this is fantastic. That's how you can reach Miss Rosanna. Fantastic. Thank you so much, Rosanna, for this.
Pleasure. Hopefully I
And
answered a lot of
shout out
questions.
to Miss Ashley for referring you to my podcast.
Yeah. Right. Right.
So, everyone, I of course will have all of Rosanna's information in the podcast. And then I want to thank everybody for listening, for watching. If anybody has any questions about acupuncture, Rosanna can answer them at an intake if you're a new patient.
Yeah.
And if anybody has any problems letting go of negative emotions or traumas, please contact me at joankaler.com because through energy healing, clinical emotional freedom techniques, I can help you with that also. It has been my honor and so much fun to meet you, Rosanna.
Likewise, John.
Thank you, and thank everyone out there for listening and watching. I so appreciate all of you. And for right now, I will say namaste and take care.